Okay, so for this injury breakdown video, I'm going to talk about ACL tears. And so I know, everyone's got an ACL tear, right? But how does it happen? Well, first of all, what is the ACL? So your knee joint has 4 ligaments that hold it together. It isn't held together by muscles. The muscles pass over them, but it's basically the ligaments that are in the knee joint that are going to control the stability in the knee joint. So imagine them being like little bungee cords. So your ACL is going to prevent your tibia, so your lower leg, from going too far forward, and your PCL, your ACL is your anterior anterior cruciate ligament, and your PCL is your posterior cruciate ligament. So your PCL and your ACL kind of make a kind of cross, and so the ACL goes and prevents the lower leg from going too far forward when you straighten out your leg. Your PCL prevents your lower leg, your shin, from going too far backwards. So they are like bungee cords. And when you basically plant your foot and you are, holding firm with your lower leg, and you twist in the opposite direction with your thigh or your body, basically you're going to tear the structure. So there's too much force going through it. It's basically your foot's going to stay planted one way, your knee's going the other way, and there goes your ACL. So not fun, right? Now here's the thing: if you're female, you're more likely to sustain an ACL tear. There are studies showing that women playing sports are a little bit more susceptible to having an ACL tear when it's closer to their menstrual cycle, just because your body is going to be prepping to be impregnated, and so allowing space for the baby to expand and grow, so your joints become a little bit more lax. So that is one study. The other part is that women's ACLs that ligament is a little bit shorter compared to our male counterparts, and also the notch in the femur here, in here, the intercondylar notch is it's a little bit smaller too. So women might be a little bit more susceptible to having that tear happen, and so there's that. Women tend to use their quadriceps more, so that's the front thigh muscle, a little bit stronger there, whereas men are more stronger in their hamstrings, so they're going to tend to activate their hamstrings more. So when you're, say, slowing down to plant and shift, so deceleration, the forces there aren't able to be controlled, and you turn and pivot, and poof, there goes your ACL. So lots of different things there. So when that happens, you may hear a pop, you may hear, you might have immediate swelling, you probably will, and might have bruising. You're going to want to get that taken care of right away, and see the sport medicine doctor, and whether you are, and then they may refer you to a surgeon depending on the severity of what where the tear is at. So I know that's a lot to take in for an ACL tear, but hey, there's a lot of people out there that have got them, so hopefully that helps and you guys understand a little bit better. Okay.